Welcome to another new episode of Canada News Time. This is Kavitha here from the capital of Canada, Ottawa. I have with me a special guest, Dr. Ramachandran Nair, retired Vice Dean, Emeritus Professor, School of Epidemiology and Public Health, Faculty of Medicine from Ottawa University. Welcome, sir.
Thank you.
I know you've been working in this field for many years. I just want to know more about the condition in Canada. It's been 12 weeks after this lockdown, and now most of the provinces are preparing to reopen, right? So I just want to know more about how things are in Canada and what are the predictions, because you were the first one, you were the one who predicted that there could be a chance for second wave. So I just want to know how it's going to go.
Well, the second wave in any epidemic is almost expected, but in this case, it's even worse because we have been in a lockdown for a long time, and we are gradually opening up, and people have pent-up desires, and they will start coming up and forget the routine things that we are supposed to be doing, like social distancing, hand hygiene, and wearing the mask. All those things people will gradually forget, and that will create second wave. And second thing is, we do not have a vaccine yet, and we do not have enough of a herd immunity to avoid the incidence of the disease. So by both those criteria, we are going to definitely have a second wave. The question is how severe that second wave would be. It will depend upon how people react after the opening, whether they can still keep the social distancing and wearing the masks and hand hygiene. All those things will determine how serious that second wave will be. In addition to that, the recent incidents of the protests and people gathering in a public place, forgetting some of those rules of public health, can also increase the social the incidence of the disease in the second wave.
How about the vaccine? I mean, when do you expect the vaccines to be out to the public?
In the normal case, I would have said 18 months is sort of the time period that we think about once we start finding a vaccine and then testing it out and everything. In this case, because there's a very concerted effort to accelerate this process, both in the United States, England, China, and all over the world, there's a very accelerated process. So people are hoping that we'll have a vaccine by the end of the year at the latest. I personally don't think it will be available until probably next March or maybe even June, July of next year. And until we get a vaccine, we cannot really avoid having a second wave or even a third wave, depending upon how we face this.
Okay. So do you mean that the tests have already begun? I just want to know whether somebody have already come up with some vaccine.
Yes, there are quite a few vaccines, up to about 30 vaccines that I know of that is under test. Some of them are in the very development stage, but many of them have actually crossed the safety barrier. That is, they have established that the vaccine is safe. Now they have to figure out whether it is effective, meaning if you give it, will people avoid getting the disease? And that will take time because that will take clinical trials. And that if a proper clinical trial is done, that takes 6 to 8 months before it's done and analyzed. And because every time, not only just get the data, but you have to analyze it and make sure that there's no bias in the results. And that takes time. So in a normal case of course of events, it's about an 18-month process. But this time, people are hoping that it will be much faster. And it's possible that we'll have a vaccine by the end of the year, but personally, I'm not convinced that. I think earliest I expect is sometime in next March.
Oh, next March, 2021, okay.
Yes.
Okay. Do you follow the news from India? I'm pretty sure that you've noticed that the numbers are rising every single day.
Yes.
It's a big worry for most people like us.
Okay.
So I just want to know what your thoughts are to make sure that it will be safe in India. What are the things that people should follow in the coming weeks or months?
Yeah, I have been encouraged with the progress of the disease so far in India, but suddenly in the last week or so, things have started getting worse. And it's possible that it will get even worse because the country is opening up. And there's a lot of traffic between the countries. It's a large country and a huge population. and the contact tracing and isolation is not as good as a lockdown. So things are probably going to get worse. I just hope it doesn't get out of control, but it's quite possible that things will be much worse than what it is now with the opening up the country.
Okay, okay. So any proper measures that you would want to advise to the people?
The people have to keep the public health advice. The main things are social distancing, hand hygiene, wearing the mask when you are going out, and keep the distance, and that could alleviate the problem. And the problem is, as soon as the country is opening up, people are going to forget all these public health measures. It's if you are locked down, you keep remembering about it because there is a constant reminder that you had to do that because you are locked down. But once you start going into the public and doing your daily activities, you are bound to forget some of those, and that is going to make the matters worse. So people just have to remember that the epidemic is not over, and you need to be very, very careful.
Okay. And there's another thing which I noticed, in India, where people have tendency to isolate the ones who have already been infected with this virus, as if it's like a HIV, or there's some sort of like prejudice that exists in the mind of like people, right? So how would you want to address that particular like social issue?
Yeah, again, it depends on the situations. Like, generally, I don't think this is something that we need to have to isolate, to discriminate people just because they have been tested positive or they have been suspected of having the disease. It's just like any other disease. What is important is that once we identify somebody or suspect somebody having been exposed, we need to have a good contact tracing and self-isolation, or necessarily quarantining if they are positive. As long as those measures are in place, there is nothing to worry about. The problem is, of course, in some places. I mean, Kerala had a very good example of those things, but some states like Maharashtra and all, the contact tracing and isolation is not as effective as it was in Kerala, so things can get really bad. And with opening up, when people are going to come, especially the temporary workers coming from one state to the other, things can get out of control unless authorities can do only a certain amount. The people themselves have to keep in mind that the epidemic is not over, and they have to keep their guard and make sure that they follow all the public health advice.
Okay. Yeah, I think that's all. That's a very important point for everyone to keep in mind, I guess, especially where people doesn't get the seriousness of it because they all want to work, they want to like earn, right, for their living, and so it's difficult over there. So yeah, thank you so much for those words, and I'm pretty sure that it will certainly have a good impact on everyone. Let's hope for the best.
Thank you.
Thank you so much for your time.
Okay.
Yeah, thank you.